This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together. This video will be presented in 10 sections. Section 1, Introduction. Section 2, How to get started. Section 3, Hand hygiene. Section 4, Prepare a clean workspace. Section 5, Gather supplies. Section 6, Prepare supplies. Section 7, Scrub the hub. Section 8, Pulse flush. Section 9, Inject medication. Section 10, Flush medication. Section 1, Introduction. First, we will go through the introduction. This video is designed to be a guide for those who are taking medications that come to them in a syringe to be pushed directly into your IV line. Please ask your home health nurse, infusion pharmacist, or doctor for specific instructions, as some of these steps may or may not apply to you. Please watch this video as many times as you need. If you have a caregiver or family member assisting you, please have them watch this as well. Section 2, How to get started. Now, let's get started. Your nurse will go over your provider's orders for your medication. The first thing to think through is the timing of the infusion. You will need to take the medication out of the refrigerator in advance. Your home health nurse will tell you how far in advance you should take the medication out. This will allow the medication to return to room temperature. If you forget to remove the medication prior to starting, it will not cause you any harm, but you may feel chilled during the infusion. Do not attempt to warm up the medication. Now, let's talk about the most important step, hand hygiene. Practice good hand washing. Washing your hands helps reduce your chance of infection. Use soap and water at first. Make it a habit to wet your hands. Apply soap until lathered, and then scrub your hands for at least 20 seconds. To make sure you are taking 20 seconds, sing the happy birthday song twice. Then dry with a clean paper towel. You can use hand sanitizer after you've already washed your hands with soap and water. If you use hand sanitizer provided by your healthcare team, rub a nickel-sized amount between all parts of your hands using friction for at least 20 seconds until they are dry. Never wave or blow on your hands to speed up drying. Even if you are using gloves, you must still wash your hands. If your nurse tells you to use gloves, put your gloves on after washing your hands. Section 4, Prepare a clean workspace. Now it's time to prepare a clean workspace. Before each infusion, find a clean, dry, hard work surface to set up your medication and supplies. If your nurse gave you a SAS or SASH placemat, put this mat on top of the work surface. Clean the workspace, including the SAS or SASH mat, with a gentle cleaning solution, such as a disinfectant spray, or with alcohol pads. Wash your hands like you did before. Section 5, Gather supplies. Your home infusion agency will provide you with these supplies. If you are missing any supplies, contact your home infusion agency. You will need 2 normal saline syringes, 1 heparin syringe if prescribed, 1 syringe with medication, 4 to 5 alcohol pads to clean your supplies and hub or IV line tip, 1 trash bag such as a small grocery bag, and 1 sharps container. Double-check your medication. Compare the information on the bag to your orders and make sure it is the same. Does the medication have your name and date of birth? Is the medication name correct? Is the medication amount correct? Is the medication expired? If any of this information is wrong or the medication is expired, stop. Do not start the medication. Call your home infusion nurse or pharmacist immediately. Section 6. Prepare supplies. Wash your hands as you did before. Now, prepare your supplies. First, place the alcohol pads and the 2 saline syringes on the SAS or SASH mat. Unwrap the saline syringes and place them on the first and second S of the SAS or SASH mat. If your provider has ordered heparin, unwrap the heparin syringe and place it on the H. Most patients will not need heparin. Remove your medication syringe from the wrapping, if there is wrapping. Place the unwrapped medication syringe above the A on your mat. Place the trash bag close by and the sharps container within your reach. Wash your hands as you did before. Section 7. Scrub the hub. You are now ready to prepare your syringe and scrub the hub. First, pick up the saline syringe from the first S on the SAS or SASH mat. You will need to get rid of the air bubbles in the syringe. Loosen the end cap of the syringe, but do not take it off the syringe. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out without pushing off the syringe cap. If the cap falls off, you will have to start again. Tighten the cap back on the syringe. Once the air is removed, you are ready to flush the IV line with saline. With an alcohol wipe, scrub the end cap of your IV line or the hub for at least 15 seconds using friction. Be sure to get all sides as well as the top. This is scrubbing the hub. Do not let the end cap touch anything and do not touch it. If you do, you will have to scrub the hub again. Discard the alcohol pad. Section 8. Pulse flush. It is now time to pulse flush. Now you will pulse flush the end of your IV with saline. Remove the cap from the syringe. Attach the saline syringe to the center of the hub and push and turn clockwise until attached. Be sure to unclamp any clamps on your catheter. Now, use the push-pause or pulse flush method. Push 1 milliliter of fluid, pause, push another milliliter of fluid, pause, and keep going until the syringe is empty. Remove the syringe. If it is difficult to flush, check to make sure that the clamps are unclamped and try again. If you are still having trouble, contact your infusion provider. Section 9. Inject medication. Now you are at the A, or administer. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will remove the air bubbles and scrub the hub in the same way as you did with the saline. Now, connect the medication syringe to the IV line's end cap using a push and twist motion, like turning the key in an ignition. Slowly push the IV medication into the catheter. Push a tiny bit, then stop. Push a tiny bit more, then stop. Your orders will tell you how long it should take to push in the medication. When you are done, remove the empty medication syringe and throw it away. Section 10. Flush medication. You are now done with the infusion. Now you need to flush. First, wash your hands like you did before. Pick up the saline syringe from the second S on the SAS or SASH mat. You will need to get rid of the air bubbles in the syringe. Loosen the syringe cap, but do not take it off of the syringe. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out. If the cap falls off, you will have to start again. Tighten the cap back on the syringe. Once the air is removed, you are ready to flush the IV line with saline. Now scrub the hub. With an alcohol wipe, scrub the end cap of your IV line or the hub for at least 15 seconds using friction like you did before. Do not let the end cap touch anything and do not touch it. If you do, you will have to scrub the hub again. Discard the alcohol pad. Remove the cap from the saline syringe. Attach the saline syringe to the center of the hub and push and turn clockwise until attached. Now, push 1 to 2 milliliters of fluid at a time using the push-pause or pulse flush method until the saline syringe is empty. It should take about the same amount of time as it took you to inject the medication. Remove and discard the syringe. If your provider has ordered that you also flush with heparin, pick up your heparin syringe. You will first need to get rid of the air bubbles in the syringe. Loosen the cap of the syringe, but do not take it off the syringe. Hold the heparin syringe with the end up and plunger at the bottom. Pull back on the plunger slightly to break the seal. You will be able to see an air bubble in the heparin syringe. Slowly push the plunger up to let the air bubble out. If the cap falls off, you will have to start again. Tighten the cap back on the syringe. Scrub the hub again for 15 seconds with a new alcohol pad, as you did before. Remove the cap from the heparin syringe. Attach the heparin syringe to the center of the hub and push and turn clockwise until attached. Now, push 1 to 2 milliliters of fluid at a time using the push-pause or pulse flush method until the heparin syringe is empty. Remove the syringe. Clamp your IV if your nurse instructs you to do so. Wash your hands one final time as you did before. You have now infused your medication. If you have any problems with your infusion, call your home infusion provider.